Thank you. Good morning, everybody. Good morning. You just had coffee, hopefully, or tea. Hopefully, you're a little bit more awake. I will try to move through this fairly quickly, but slowly in speaking so you can understand, because we have a lot of great panelists this morning. So, by a show of hands, how many of you would like to know exactly who comprises your supply chain workforce in your country, or the supply chain workforce that we've been talking about? Anybody, do you want to know who makes up your supply chain workforce? Yes? Okay. Do you want to know what educational opportunities exist for that workforce? Yeah? Okay. What about job descriptions? Do you want to know what their job descriptions say? Okay, great. And as Mr. Cometo this morning from WHO and GUA mentioned, there's a lack of data on our supply chain workforce. And in the next 15 minutes or less, I'm hoping to introduce you to a tool that will help you answer some of the questions that I just asked you, and also this question of what is the state of professionalization of the supply chain workforce, either in your country or the program that you're working with. And I hope in this presentation to get you motivated to know a little bit more about your supply chain workforce and how you can do that. And more than anything, a place to begin. I think the question is, where do we begin when we're thinking about what do we know about the supply chain workforce? So the USAID Deliver Project and People That Deliver have developed a toolkit to help public health supply chain managers assess and improve the management of their human resources. It provides a structured and rating-based methodology designed to collect data needed for a rapid but comprehensive assessment of the capacity of the human resource support system for a country's supply chain. And this assessment guide and toolkit is composed of four components of a data collection tool, one being a reference document review, so looking at all of the background documents that describe different pieces of the supply chain workforce, a supply chain profile that is a questionnaire designed to create a profile of the particular supply chain that you might be working in. We saw in Jessica's presentation this morning with Bioforce, in many countries, there are many different supply chains, and in some cases, you might need to first define what supply chain are you looking at. It also includes a diagnostic dashboard, which is an evaluation tool used to define the transition stages of each of the building blocks that the assessment tool looks at, which I'll talk about in a moment, and includes a supplemental survey designed to gather additional data with additional context and detail for your assessment. And the overarching guide also includes a curriculum to orient your team that's going to be collecting all of this data. So it's not just tools, but it's also a tool for how to use this tool. And this assessment tool, we'll just go over it. The purpose of the tool is to document the state of your HR capacity for the supply chain, identify opportunities for individual and organizational capacity of supply chain human resources, and to document the professionalization efforts for the supply chain workforce. The approach that this tool uses is generally 3 steps for any assessment: preparation, where we're looking at the document review, so we're reviewing those country-specific documents; implementation, where we're looking at implementing the surveys and the focus groups; and analysis and reporting phase. And what's important for this approach is building ownership, and so building country ownership of the process. So it's not a team coming in from outside to assess your human resources in supply chain, but working together with a country team and stakeholders, and involving them very early in the adaptation of the tool and making it country specific to your situation. And then also adjusting the surveys that we use for the interviews, and using the interviews guides not only to collect data, but also as an advocacy tool. So while you're doing the interviews, you're advocating for human resources for supply chain management. And the deliverables or outputs of this assessment include a detailed human resource analysis that describes the state of your public health supply chain workforce. And it should result then in an HR strategy, can inform a strategy and implementation roadmap that identifies key activities and stakeholders and timelines that are required to implement that strategy. And then what we hope for the overall output of the results of that strategy and the roadmap include the ability to strategically inform limited funding, direct the limited funding that we have to particular activities or interventions that are going to make a difference in explicitly connecting the human resources world with the supply chain world, which is all about what People That Deliver is doing. And then ultimately to strengthen the capacity of the supply chain personnel working in your countries to improve access to health supplies and improve the lives of the clients that we're serving. This assessment guide and tool is based on the human resources for health building blocks. And by nurturing the 5 human resources for health building blocks, supply chain personnel are sourced, developed, and professionalized to support sustained supply chain performance. And each building block that you see here on the slide is individually assessed in this tool, and within each of these building blocks are different dimensions that are also individually assessed. I'll give you an example. So this slide shows you on the left-hand side the different building blocks, what we also call components, and on the right some examples of some of the dimensions that the different tools, whether it be through the interviews or the focus groups, assess. So looking at powerful constituencies. Is there a supply chain management HR champion in that country? For policies and plans, does a human resources for health information system include the supply chain workforce? Workforce development, looking at all the different capacity building interventions from pre-service and in-service training, and then all the way down to professionalization. So does a supply chain certification exist? Are there professional associations in country available for that workforce? So those are the components that it looks at. And then this slide, there's a lot of text on here, and all of these presentations will be available for you. But what I wanted to highlight is that the tool operates in 3 phases. Again, as we said, preparation and looking at the different resources that you're going to have. So the resources at the top. So the resources for this assessment tool are really the people who are behind it. And in preparation phase, as I mentioned, you're adapting the tool, applying it to a specific context and orienting your team on how to use it. In phase 2, you're doing the data collection, and then through the focus groups, through interviews, and then in phase 3, we're putting all of that into analysis, putting it into the diagnostic dashboard to see what is the state of all of these 5 building blocks, HRH building blocks for the supply chain. And these are just a little more information on some of the different tools, so the supply chain profile, the focus groups and interviews. And the result of the supply chain profile will give you an accurate picture of each supply chain. For the focus groups, you'll be able to gather data on each of those components and building blocks to give you an accurate understanding, and then the interviews giving you some additional contextual information. And after you get all of your information, what results, you put everything into a diagnostic dashboard that will give you this very pretty petal graph. And here, what you can see around in the different colors, each of the colors represents one of the building blocks that we just talked about. So the orange at the top is powerful constituencies, the blue here on the right, policy and plans, the brown kind of rust color being workforce development, green, performance management, and blue, the light blue at the top is professionalization. And the text you see around are the individual components that you're looking at within each of those components. And so this would represent a country or a program that has a perfect, kind of everything's happening. It's a very mature state of the supply chain workforce because the petal graph is all completed. But what we might see in different countries, these are examples from 2 countries, as to where kind of the fuller the petal of this graph, the more mature or the more robust kind of things are happening. And so as you could compare here, like on the rust colored on the left, there's not a lot going on here in workforce development, but on the right, you'll see more development with some of those individual dimensions. So it's a nice visual. It's a nice way for your stakeholders to be able to see where do we have more going on in human resources for supply chain management and where do we have less, and giving you a starting point for discussions on where to focus your strategy and implementation plan. Using the assessment tool, Andrew talked about this a little bit this morning. This tool has gone through a few iterations, and at the beginning of the People That Deliver initiative in 2011, 6 of the focus countries actually implemented the first version of this tool, and it's since been used by other partners in different countries. You can see those listed on the right. 7 other countries have implemented the tool with other partners. And the assessment results, how many of you have completed an assessment of any kind and created an action plan or a strategy, and maybe it didn't go anywhere? Anyone? Probably all of us in the audience. So something to emphasize with this, same thing. We can do the assessment, we can write a strategy, but the only way it's going to move into action is if we put some funding behind it and resources to implement the suggested activities. And a few of the results that we've seen from where the assessment tool has been implemented, it's been able to help identify the number of supply chain staff required to operate a logistics unit. It's also recommended and resulted in the establishment of a logistics management unit in some countries. It also helped us identify that recruitment of supply chain personnel is a weakness in some places, and the Deliver project developed a recruitment toolkit to kind of meet that need for some countries. And really the results open a door to having a larger conversation about what is required of our supply chain workforce. And we've had some lessons learned in terms of how do we begin with this assessment, and that really it is about adapting it and making sure that it is appropriate to your country context. It's an opportunity. We've really seen it as an opportunity to merge and bring in Ministry of Health human resource personnel. So people who've really had nothing to do with supply chain previously, this is a very great opportunity to bring them into the conversation and engage them and introduce them to some of the challenges of this workforce. As we heard from Namibia earlier this morning, it's also helped kind of identify that pharmacists are sometimes seen in countries as the primary supply chain workforce. Sometimes that's dictated by law. In terms of this, the pharmacists are the only ones allowed to kind of handle medicines, and so that interpretation of that law then puts some limits on supply chain personnel. And then it's also given us some opportunities, as mentioned earlier, to incorporate the supply chain workforce into existing human resource information systems, into overall HRH strategies, and to think about how the supply chain workforce isn't just a support staff cadre. It needs to be recognized as a profession that's essential to improving the performance of our supply chain as a whole. And if I've given you a taste of something that you want to know more about, tomorrow afternoon, Ms. Moto Iomba and Sonia Brito Anderson and Edgar Barillas will be leading an interactive workshop introducing you to the tool on laptops, getting some appreciation for the use of the tool. So I really encourage you to go and find out more about the assessment guide and planning tool if you want to have a place to know where to begin in your countries. And so hopefully with this tool, you'll be able to answer this question: what is the state of my program's overall HR for public health supply chain management? What's the state of professionalization? You can access this tool on the Deliver website, on the People That Deliver website, and also at the PSM Toolbox. So thank you very much, and I look forward to your questions.